Okay, so now again we've got another exciting lecture about Tendiboots, which is an area that I don't know enough about that I think would be really good for practice. So they're going to go through some theory with you, and we've also got a couple, well, 3 demo dogs. And Anna, who's at the back now, she's brought a couple of Great Danes and one that's deliberately not sound. So that should be interesting from a gait analysis point of view as well. Okay, so let's give a warm, cheesy welcome to Tendiboots.
Thank you very much for everyone, and thank you for the invitation. So I'm Stefan. This is Sarah. We will introduce ourselves in just a few seconds. So I'm French. If you didn't understand my accent, or if you don't understand something, feel free to let me know, and I will try to explain a little bit better. So as I said, Sarah is one of our users, and I invited her to come because it's sometimes much interesting to know the technical side, but also the field side. So this is why she's here. So my name is Stefan. I'm NGCO co-founder and the director of technology, I should say. So if there is anything wrong with the device, the customer come to me, sorry. And I'm mainly responsible for the future of the device and the company wide. I'm not a vet, but I am a computer science engineer, and I have been supporting practitioner in for gait analysis for over 9 years now. But before that, I was also in the data because I was doing approximately the same with motorcycle. So I was in the World Championship of motorcycle, like the Formula One of motorcycle, and I was doing the same, but for pilot this time. And I'll let you introduce yourself.
So obviously I'm Sarah. I only use in Motion. It's a rehabilitation centre. We mostly treat dogs, the odd cat, rabbit. I traditionally trained my master's degree in animal manipulation. I got that from the Veterinary College of Chiropractic, completely different style. Mostly my treatments are spinal manipulation based. We also do lots of myofascial release. My colleagues also support me with some physiotherapy. We also do hydrotherapy with an underwater treadmill. And we have lots and lots and lots of animals that come through our doors. And we've just started using Tendiboots as part of sort of our treatment plans. So, yeah.
Yeah. So if just a quick introduction of what NGCO is, so you understand a little bit better maybe. So NGCO is a French company that was founded in the 2016, and at first it was more for equine, hence the name NGCO. It was for equine connected. But more and more of our users were doing both canine and equine. So we had the request a lot if we could do the same for canine, and this is why in 2023 we started to have the same device also for canine. Today we are a team of 8 people, so I founded this with my wife, and now we have also biomechanist, data scientist. We have also one vet that is part of the team, obviously developers and marketing people, and today we are supporting more than 300 professionals across 30 countries. So it is a device that is very well accepted and exported. So from New Zealand to California and obviously Europe a lot, but a lot of professionals use it. Mostly vets, but also physio and people that are doing care for the animal, but almost no owner. It is only professional that use the device. And just for the record, today we have more than 40,000 analysis of gait. So it is a big database that we have, and we start to understand better and better what a good locomotion should be or should not be. So the Tendiboots technology, so as I said, we do the same for both. So this is the last version, because at first, the first version was all the electronic was inside a boot, so you would not see anything. But since we have updated for the canine version, we have also updated for the equine. So as you see, for the equine, you put the sensor just above the fetlock, and for the canine, above the tarsal and carpal joint. And today we will mostly focus on canine, but 80% of what I said today is also apply also for equine. So this is basically the same. So just to explain to you how it works, but we will see it later. You have a small sensor that is like this. So you put this sensor on each limb. So it is about 11 grams. So it is very. It doesn't affect the locomotion. And you record the dog for 10 seconds, so it is on a straight line at a regular gait. So we don't want to stop, restart, etc. And basically, in a couple of seconds, you get the result. About the results, this is the information that you get. So first of all, you will have the number of strides that have been analyzed. So it's okay if you have not the same stride for each limb. It means that some strides are not analyzed if it's a rip or if it's the first stride or the last stride, etc. We try to get and to analyze only the strides that are reliable. You will have the angular velocity, the stride height, the stride length, the peak vertical reaction force. So we get this because we know the mass of the dog, and we know the acceleration before, during the impact, but also after the impact. And with a little bit of math, we are able to compute and to have this kind of information. And after, we have also the duration, so the full stride duration and the ground contact duration. If you have any question, feel free to stop me and to ask. Inside the app, so the app is, we try to make it very user-friendly, so you don't have to have too much time thinking about it. And so, as I said, you have all the information that you see, and if you click on it, you will have also more information if you don't remember what is it. And you will also see that some parameters are in bold. That means they are outside of what we usually see, and this is a little highlight to maybe give you a hint. And if you click on it, yeah, you will see more information. Why is it bold? Is it significant or not? So yes. So we always compare left and right. We don't compare front and hind. So what we do basically is we get the data on the left, we get the data on the right, and we do a symmetry. And basically, you would want that it would be 50-50. We have also some. Oops, sorry. So this is a new view that we have just started in early June. It will take the same number that you saw previously, and it will tell you if it's in the green area or the red area. And the green area, it is basically healthy dog will be 90% of healthy dog will fall into this area based on what we have recorded so far. So we have thousands and thousands of recording of dogs that are healthy, that have been labeled as healthy, and this is why we have been able to have some statistical interpretation, and we are able to show that to you in just a couple of seconds. You have also some other graphic that are optional, which is, for example, the history. So you will have the historic view inside a single graph. So you see if it's on the 0 line, it means it's perfect. So for each parameter you can see. And also we are starting to try the PDF generation report, because this is something that a lot of people were requesting, to either to give them to their owner, the client, or to save it into their software. So we update regularly the system. So we listen to what our customer and user says, and we try to deliver as fast as we can. So maybe you have seen us in some congress, whether it's us or some of our users were also talking about it in France, for example, even in Brazil or in Italy. But we have also been in Portugal and in South Africa presenting the device, and we have presented also two posters. So in just a few words, we have created an AI, because now it's the new way is AI. So we are forced to follow the train, but to be accurate, we have asked an AI to try to identify, based on analysis, if she would be able to pick up which limb was affected or not. So we trained it with our database, knowing which limb was affected, and after we give it a non-node database, and the accuracy so far was about 8 out of 10. She was able to pick up the right affected limb. So this was the first poster, and the last one was also we have induced lameness on a dog with 3D printed parts above the paw of different size. So we created different grade of lameness, and we video recorded the dog, and the dog was also assessed by 2 individual veterinarians, and we measure the peak ground reaction force and the symmetry of the dog for each recording, and the correlation, because with the asymmetry and the grade of the vets was also very, very good. So this one we also presented during a congress. And just to finish the introduction, the theoretical introduction. So the UK, actually we're UK registered business to try to facilitate the shipment and the collaboration with the UK, because it's sometimes difficult now. And since we have between 20 and 30 people here, it is very helpful. And so Sarah will give you the floor to explain a little bit what we have been working on lately.
Yeah, so as sort of mentioned before, I've just been asked to come down and sort of present my experiences with Tendiboots so far. In the clinic, as I've mentioned, we offer lots of different types of therapies, but each patient that comes to our door always has a very thorough assessment, obviously visual, manual, and this is where we integrate the Tendiboots gait analysis system. It helps to basically quantify and objectify what we see. Sometimes it picks up other things that we don't see that we can certainly integrate into our clinical reasoning and treatment planning for our patients. Once we've got that underway, we tend to, especially for the hydrotherapy patients that will be coming very regularly, we then tend to use the Tendiboots system on their review sessions, so a few weeks into their treatment planning and again prior to discharge. We find it really useful because you can objectively sort of track their progress. You've got the numbers and quantify what you're seeing. It helps us, it helps the reports that we give back to the referring vets, and it also really helps with the clients onboarding, you know, getting them really on board and committed to the sort of the continued care for the well-being of their dog. It can also help prior to discharge if we are seeing some gait abnormalities still, although the dog looks rehabbed, it looks healthy, it looks sound, it looks, you know, prepared not to see us again. But there are some other gait abnormalities that are kind of cleaning up on the system. You wouldn't necessarily see it. You can set their expectations a bit better. You know, we're always saying, just be careful with the dog. You know, you've done all this rehab, it's great, but be careful. You can be a little bit more specific. Just be careful. Monitor the movement of the left hind, for example. There's potentially something there. Just being able to manage the patient like absolutely 100% part of their body. So for the purposes of today, we did a little bit of data collection immediately pre and post spinal manipulation. And there was a few dogs that were quite interesting to see and to compare using the Tendiboots system. So all the dogs that we looked at were clinically sound. By that I mean there's no obvious head nod or pelvic hike. There's no known disease or pain. Obviously they were also screened for sort of heat swelling, skin lesions, etc. They were also acclimatized to the gear, so popping the straps on their legs can affect their gait, obviously, for the first minute or so, but they adapt very, very quickly, kind of normalize their movement within a couple of run-ups, and obviously getting used to the space. The space we used was very quiet, was very flat, fairly perfect for a trot-up, you know, trying to minimize all the variables. Most of them were all comfortable walking on the lead, and to heel. Some were actually excitable. But yeah, this is my lovely dog. Both of them are my lovely dogs. I always forget that one. Sorry, this one's my favourite. But the activity technique is very, very gentle, very, very soft. It's, you know, accepted by a lot of dogs. So that is the technique we used in terms of manipulation of the spine. We were looking to, much like chiropractic, realign the skeletal system and mobilise the joints where we could. And yeah, like I said, we used the Tendiboots system immediately prior and immediately post treatments for each dog.
So for the first dog, maybe if you can.
Yeah. So subject one, very, very brief kind of mentions of the gait observation. Crabbing to the right, this one, so the left hind was placing immediately. There was a reduced stride length on the left hind, and the asymmetry that we could see was more pronounced when they were trotting, and this one was quite subtle. So yeah.
And so this is the data that we have shown in at work this time, because we saw also that what the clinical observation said, we were also able to see it with the data. So if
you can just about see the bold,
yes,
the stride length and the ground reaction forces here for the left hind, much lower than it is compared to the right hind.
Okay.
So it matched with what we saw.
And so I put it in a tape. So it is based on over 60 strides, so it's not only 2 or 3. So we have a good average. And so if we see here, it's much lower here, but also the stance duration. There is also a little bit of left here and here, way less than the difference between the hind, but we have also something on the front. So here the number correlates well with the clinical observation, and we see that it tends to be LH. And so after the manipulation, if you can maybe.
Yeah, so the movement was still crabbing slightly to the right, although improved. the stride length on the left hind was visually reduced, but the dog remained excitable during the trot work. That very, very brief overall impression was that the dog looked, much straighter, more comfortable. Yeah.
And so when we look back at the data, so we have more stride, but that's okay. But now we are way better and way more asymmetric between left and right. So if we do the same exercise and we check back the data, we see that it's almost the same here, it's almost the same here, and same for everything. And also the front is still different, but it's way better. But if we focus on the left hind, which was something that popped up after, we see a clear improvement for this limb. But looking at table, it's difficult, and you cannot do it while you are with the dog. So this is why this kind of view is good, because we can see that even on the front, even if we are at the limit, sometimes we are always on the green. And here we can see that we start to be on the red here and here, the stride length, and after, so yeah, that's what I said. And after, we can see in just a few seconds, we don't need to put the number on the table and check everything. You can see that we are on the green area everywhere.
Stefan, the data that you've collected and the application of those numbers to the test subject, are those like age adjusted in any way, or do you put any biometric information about the animal into that is looking at the averages for a 3-year-old dog, as opposed to if your test subject is 11-year-old Labrador or something?
You only put the weight. That is what we need to make our calculation. But other than that, no, they are the dog is its own witness, and so we compare his left to his right, and we do the same for the all dogs. So it's kind of normalized, even if it's a big dog or a small dog. It goes at the same pace.
It's about symmetry.
Yes, exactly. Sorry, that's what I said. Next, we choose to show you the subject 3. Maybe if we can explain it a bit.
Yes, so this one was grabbing to the left. So the right hind was immediately placed. It was fairly mild at walk, worsened in drop. Reduced stride length on the right fore and the left hind was in visual during the gait assessment. After manipulation, the increased stride length and flight arc of all limbs was quite obvious. The increased straightness through the trunk and hind limbs. Like I said, the dog just looked much easier to travel straight up.
So here we have a noticeable improvement before and after. So if we check how the data shows this, so here we have more than 100 strides. So we see that on the front there is some on the red always, and also on the hind, and same principle. If we check after, we see that even if we are still at the limit, because it's always difficult to be always perfect symmetry 50-50. That's not necessarily what you want always, but you want to see improvement, and this is how it's used for. And we have the same number of strides approximately. And here we see, we also see, we can objectively see the improvement here. And the final subject that we wanted to show you is a little bit different. So this time, I think there was nothing really to show, neither before nor after. So this was a good subject to know how this would be interpreted by the system, and without any surprise, it falls into all the green area before, and same after. And again, we have more than 130 stride. it's even a little bit better after, but we see a consistency in this kind of result. Yes.
The order changes of the.
Yes, you have a good eye. It is a bug inside the app that we'll fix because I say it's been up since the beginning of June, so there is still some bug. So it's difficult.
It's not ordering for some specific.
No. But good catch. But no, yes. After the fix, it will be always the same order. And if we also check this subject, and if we would check the historical view, for example, we were slightly more on the right before, and just 1 hour, 1 hour and a half after, we were much more closer than before. So if we want to be picky, we can also. So the three takeaways to take from this case study is that obviously it helps you maybe have a subtle help you in subtle case sometimes. As Sarah said, the owner also love to be part of the process, so they love to put the strap on the dog, to walk the dog, and to see the result. This is something that is really appreciated, and it also helps you track and visualize, as we just saw, the progress before, after, or even 5 weeks later, 1 month later, 2 months later, etc., etc. And so you have objective data that you can rely on and check back in time. So just to wrap up, the tool is not a magic wand that will tell you this is the issue, this is where you should look, and this is what you should do. It is only something, another tool in your toolbox that you want to use or not, but obviously you want to use it as much as you can, because it is very, very quick to use in just a few minutes from taking them out of their case and getting the result. It's about 2 or 3 minutes, and it's a decision supporting tool to help you in your diagnosis, as any other tools you may have. So
does the app store the data for that particular individual over a period of time, so you could say swipe between, because obviously not very often are you going to do a before, do a treatment, and then do an immediate after. It's going to be do a before, do a treatment, a plan of management, reevaluation, whatever you've determined, after 6 sessions or something like that, and then do a rescan.
Yeah, so you set up the dog as a patient on the app.
Yeah.
And then when you come to collecting the data from that animal, you just select it from the list of stored animals.
Yes.
And then you've also got your browser version that you can go on your laptop and find all the graphs and stuff like that, and it compares it over time.
So yes, inside the app, for now, you don't have, for example, the historical view or something that will show you based on 4 weeks ago. Now it is better or worse, etc. But this is something that we will have also in the near future, because we update the app regularly. First of all, we put it on the web version, as Sarah said, but people not always go back and forth with the phones.
How big a space do you need to?
Depends on the size of the dog.
Yeah, it's about 10 strides. Usually it's about 10 strides. It's 10 seconds, so you have 1 second to wait at the beginning and after. So it's between 10 meters and 15 meters usually. No, it can be also at work. We most often we use it at trot, but that can work. That can work at work also.
Have you been tested on treadmill?
Yes, we are doing that, and we have most of our users doing that, and it's consistency and reliable also on the treadmill. Not underwater, but
Unfortunately, that was my first question. I couldn't go underwater.
yeah.
And is that on the parabolic treadmill or the flat treadmill?
Flat, flat. Yeah. For horse, it would be 30 to 40 meters. It's like we try to incorporate it into a regular vet check. So what you would usually do, we have tried to make it as quick as possible, but you can repeat it multiple times. So it is short. 10 seconds is short to have a good analysis. So this is why we recommend doing it 4 times. So you have between 40 and 50 strides. So it's better.
If you do it if you do it 4 times, can it then average the base to give a
Yes.
better accuracy?
Yes, exactly. So you do it 4 times, and after you create what we call an exam that will you select which one you want to collect, and it will not do an average, but reanalyze everything as it was a single big recording. So with demi-tour, when you do like this, up, like this.
Figure 8.
Yeah.
But if you want a treadmill, you can just do it for 30 seconds or a minute.
Yes, in this case, you would have to, as soon as it stops, you restart. Yes, because yes, when you start a recording, it's a countdown, and after 10 seconds, it stops. So you just have to worry about starting, and after you can you can watch, and it's okay.
It's very, very quick. It's literally like it stops, then start, stop, start. So it's maybe a second in between recordings if you want to continue. It works well.
Yes, it will work the same, but obviously the data will be different. So after that, it's up to you to be aware how you use the device and how it could impact. Yeah. Yes.
So to experiment with that, really. Yeah.
So it would work, and but the database that we have and the green and red zone that I've shown you is 95%. It's on hard surface. Just so you know.
Has it been tried at all? I'm thinking about, there are some agility dogs that you often see where after they ran, after they performed trials, I don't mean put them on agility competition, but could you put Tendiboots on and have them do some kind of very obstacle? I suppose I'm asking how robust they are. Do they stay on quite well when they're strapped on?
Yeah, the dog could be flying around on the end of the lead and it would still stay on.
Yeah.
For the experience I've had, at least.
Yeah.
Sarah, do you have a stance analyzer? Do you have a
No. That is something that I wanted to purchase. Actually, I was having a look at both of them at the same time. I was having a look at researching Tendiboots, and I decided to purchase the gait analysis prior to the stance analysis. From personal choice, really. So it's definitely something, a stance analyzer, that is of interest.
But we have a lot of people having both, and they say they are complementary. They tend to say the same. Maybe in motion, what we heard is that in motion, maybe you are able to pick up improvement a little bit sooner, but they are complementary, and we have a lot of people having both.
So you'll see functional changes faster with the Tendiboots.
In motion, yes. This is what we get as feedback. So if that's all, we can I can prepare everything. If
See it in action.
yeah, up.
Which dog
Yes.
would you